Okay, hello and happy Saturday, everyone. We are back with another episode of the Everyday Leader series. I'm your host, Dr. Ananya, and I am back with an amazing person and healthcare leader. I will do his introduction. He has a big profile, but I will try to keep it simple. So our guest today is Fitsum Taye Negash. He is an internationally recognized healthcare leader, leveraging 17 years of experience to drive impactful change in healthcare. Holding two master's degrees, including one as a Chevening Scholar and in international leadership in health and social care. Fitsum is celebrated for establishing Ethiopia's very first surgical service at Primary Healthcare Center. And this innovation earned him the 2020 Outstanding Clinical Practitioner of the Year award by the GACOPA in Kigali. His expertise encompasses maternal and child health, safe surgery, healthcare leadership, and policy development. Fitsum is committed to fostering human resource capacity and implementing evidence-based solutions for sustainable healthcare improvement across Ethiopia and Africa. So I am honored and delighted to have my good friend Fitsum here. Fitsum, welcome. We can't hear you. Okay, I think we lost Fitsum. Hold on. Okay. Can you hear us? So we can go ahead. We can see you. Okay, we'll give Fitsum to work out connection issues. So we'll give it a little time. All good, Fitsum? Can you hear us? Can you hear me? We will resume in 2 minutes until Fitsum figures out his connections. Let's say, can you hear me? Let's say, can you hear us? Um, wow, network is just a huge issue. He is in, let's say, he's currently in Ethiopia, and he is outside of the capital city. So, let's say, can you hear me? Okay, I think I lost him again. Oh, this is gonna be a bumpy ride. Okay, so can you hear me? Your video is clear, but I can't hear anything you're saying. I can't hear your voice, but I can see your video clearly. It's really bad network. Apologies for the connection issue. Okay, I can't hear your voice to say I'm sorry. I don't know why. Your video is very clear, but I can't hear anything. I cannot hear you. Can you have you muted yourself or something? Okay, I think I can hear you now.
Yeah, I'm back. Sorry for the interruption.
Perfect. No, you're good.
It became dark even.
I can see that beautiful lake now.
Now the leg disappears and let me turn my face.
Well, I'm glad it worked out and you are back.
Thank you for the warm introduction and thanks for having me. Sorry for the interruption. And now we can proceed.
Yeah. So I'm just gonna call you Fateh because we've known each other for a very long time, and it would be weird to call you Fitsum for me. Um, so we're just gonna go ahead with a very easy question that we start off with almost every of our guests. What does the phrase "everyday leader" mean to you? Can you hear me?
Yeah, I can hear you. Yeah, for everyday leader, it was impressive, It's what it meant for me is just everyday leader. Everyone is also a leader in the principle. And you remind me one of my professor. Her name is Andra Cassidy, and she always taught us while I was in the UK. She told us we are not or you are not just a nurse or somebody else. Every one of us, or every day, we are a leader. For example, Anania, when you lead operation service as an orthopedician, you are leading a team. When you teach students, you are leading them because you are their role model. When we define leadership, leadership means impressing the team to achieve the organizational goal. Okay,
Mm.
just when you are instructor, you are
Oh, we've lost him again. Okay, go ahead. We can't hear you anymore, Fitzy. Oh, okay. We can hear you now. I can hear audio. Yeah, yeah,
can you hear
we can
me?
hear you.
Yeah, let me hold
Okay.
it like this. Yeah, just the idea or the concept of everyday leader means uh, even when you take a taxi, driver is also your leader because you just give him a responsibility to take you to your destination. Okay, your driver is also your leader at that time because he took the responsibility, and you are
Mm.
planning to achieve your goal. And that's why just we it's not about the position. Sometimes people thought leader means just you have to be nominated with someone, but in the hardship situations, in whatever situations, you can take several role to become a leader. So I like the idea of your streaming and every day and everyone is a leader. Yes, you are always proactive. Especially you impress me because while you were at University of Gondar, I
Mm-hmm.
remember that you create a lot of things because at that time when we were students, you have created an amazing, orthopedic surgical specialist at University of Gondar, and You are an impressive, outstanding leader, and I will recommend you to join even the Chevening Scholarship, because Chevening Scholarship is looking for someone who have proactive leadership style, and who had also networking skill, and you fulfill the both. So next, I hope you will go and join us soon. Thank you.
Thank you, Fizzy. That's so kind of you. See, this is live mentorship right here that you have witnessed.
Yeah.
Um, and this is really what true leaders do, right? They see a potential that you might not necessarily see in yourself, and they encourage you to bring it out and direct you to different opportunities that can help you become the leader that you're meant to be. Fitze, thank you so much. You say those things about me, but you and we've known each other when I was in med school, and you were studying emergency as an emergency health officer, right? So we both studied at the same institution, and uh, we've come a long way. And it is very impressive to see someone like you. I know your personality, and I think one of the gifts that you have is you are very a bubbly person. You're charismatic, and you can walk into any room and have anybody you want on board with the idea you're presenting. And that, I think, is your natural quality and attribute that immensely is reflected in your everyday leadership. And yeah, and I think you're the best example as to how we can leverage our naturally gifted qualities to become successful as a leader. So thank you so much for that perfect explanation of what an everyday leader is. Um, so, Fitze, I want you to start from where it started, where it all started. But you are known for pioneering your pioneering work in establishing Ethiopia's very first surgical service at a primary healthcare. And when I want people to understand, primary healthcare typically focuses on non-surgical treatment of patients, just because of resource limitations, right? And even if you have some surgical procedures, they're mainly minor procedures, and nothing that is major is done at primary health care level, which is truly remarkable. And I know the project goes and so on. I'm so impressed. So can you tell us about how that initial spark came about? Start from when you were going to your training in the first place, and how it evolved into such a beautiful, impactful project.
Yeah, thank you for this interesting. You reminded me that just at the time in 2017, I remember um, I was just, my wife. She has joined residency program at St. Paul Hospital, and the kids were also joining her, and I have no opportunity to join this residency program because my career is, as you have said, it is integrated emergency surgical officer, and integrated emergency surgical officer are not obliged to work at specialist hospitals in Addis Ababa. Even there is no structure at the hospital, including at the health center. And what I did was just, sometimes challenges and problems will give you the opportunity just to create something out of just what we always expected. And what I did was the idea of this, you know, task sharing. This even our program is just task sharing. It is no
Mm,
shifting actually. And why not we just share the tasks from the hospitals? Because hospitals, we have limited specialty hospitals in Addis Ababa, and their operation table are always busy for primary CS
yeah.
and appendectomy. So I just the idea of sharing this task from the hospitals to the health center comes to my mind. So when I asked the several leaders at that time, they told me that okay, the idea is good, but there is no
Mm,
structure for you. So how we entertain you to start this service? And I told them that just at that time, just Dr. Amir, he understands me, and he gave me the opportunity to try. And he told me that, but you have no salary or structure or
Mm,
just. And I told him that let me show you, and let me do my best. Everything will come next. Sometimes um, you have
yeah,
to be just take a risk. I just took a risk. He gave me the opportunity just to stabilize the center. And uh, in the name of mothers, I took instruments and supplies from St. Paul Hospital, St. Peter, Gandhi Hospital, and I have collected several instruments to start or to establish the first kind of surgical service at the health center at that time. And
yeah,
it was inaugurated within 3 months duration. And just after that, they were so impressed, and they gave me the opportunity to establish this structure. And I've got the opportunity to join. I became a leader of my society, Emergency Surgical Officer Society, and
yeah,
also I've got the opportunity to just to establish standards. Even I'm the one who has written the standards of the CMOC surgical service at the health center for the first time. That's why they have so impressed. That's why I've just got the opportunity to join this Chevening scholarship.
yeah,
They understand me, and they so impressed and surprised. How did you think that these things became possible?
yeah.
Currently, just imagine, just there are more than 300 health centers in Ethiopia has started this surgical service. But
Wow.
to be the first is, it's challenging. It's not
Yeah.
easy, but in the sometimes there are opportunities in between challenges.
Yeah, for sure. Oh my God, that is so impressive. I hope our audience did not miss this part. And if they did, they can go back on our LinkedIn or YouTube and listen to this again. You dropped so many important points. Uh,
Yeah,
First of all, you should never shy away from a challenge, right? You were put into a position where you love what you used to do. I remember because I worked with you, but at the same time there is really no professional vertical growth at the time set up for your specific group of professionals, so you have to recreate a lot of things. And I know that's one of the works that you've done with your society is to establish advanced trainings for your professional group, and we'll come to that. I want you to touch on that too because it's extremely important. Education is central for sustainability, right? So even if you can build a building, you can put beds and whatever, but if you don't have the professionals that are qualified in it, then it's really pointless. So I want you to go back and touch on that. But everything you said is impressive, and the fact that your project has taken a life of its own, and you're still very humble about it. And by proxy, you've saved so many mothers and so many babies, newborns' lives by doing what you have done. So that is extremely impressive and something that should be celebrated. So tell me the work you did with the advancement, the professional advancement opportunities you've created for your professional group through your society.
thank you, Ananya, for raising this important question. As you have said, there is no educational career, and every professionals lost hope from the system. And I've just took this leadership position to become the vice president. And when I've seen that, there are around 1,000 professionals in our society, and everybody, after serving for several years, because there is no vertical or horizontal career progress, they are leaving the system. Just they are serving at hard to reach areas. Those ISOs majority serves as at hard to reach areas. So there is no educational career. So what I did was just I have created several sisters. I have to join, just I have to network because I'm leading the society. Just I have searched locally. There are sister societies. Our background is health officer, so I have to network again with health officer society, and I have searched from Africa, and there is ANAC, African Network of Physician Associates, and I've become the member of that society, and I have created a platform because from the Ethiopian medical, you have several societies, medical association, even in US there is also the network opportunity. You can go and present even your research findings. So what I did was I've found Global Association of Clinical Officers and Physician Associates in 2019, and I have just shared my experience, and they're so impressed, and they even at USA last year, I have presented and surgical service at health center, and they told me that in Florida, our OR block is busy for primary CS. And thank you
Mm,
for this important idea. And we will start this surgical
wow.
service as a primary health center level. And they are so impressed, you know.
Mhm.
Sometimes our innovative ideas, we Ethiopians, our problem is just we don't try to show others, or just we don't entertain our innovative ideas.
Yeah.
These innovative ideas is our prime leaders, Dr. Theodros and Dr. They didn't get recognized because they didn't show up. And what I did was I have presented my findings, and I became awarded as outstanding clinical practitioner of the year in 2020 at Kigali from Gakopa. And I've also presented my just research findings at International Association of Physician Associate Educators
Mm,
in Switzerland and again in USA.
mhm,
Just this, it's not only for me. I have created opportunity for others, physician associates. When you just when I look at my our curriculum, we
mm,
are analog to physician associates because it's not direct physician or doctorate program.
yeah.
That's why just after several communication, sometimes people thought struggles are confronting with each other. The struggle
Mm,
is that you have to create just a good communication. You have to convince them. At
mhm,
that time, the leaders, Dr. Amir and other several ministers, just I when I've got the opportunity to meet them, I will invite them. I will show them research findings, and I will give them the opportunity to decide. And finally, Dr. Amir decided to join PhD directly,
mhm.
and MD for those interested, and several students enrolled for PhD and MD. That's our summative result,
Mm,
and that's what makes me proud, because leadership means you have to create opportunity or conducive environment for your followers.
yeah.
That's what leadership means.
Mhm.
So I did my best, and they are on the way now.
Oh wow. Yeah, I mean, you had on our previous episode, I was talking to two of my colleagues from the UK. They did a project related to orthopedic department at Gondar, and that was what they said. It's things coming together really helps the leader achieve the goals that they set out to achieve, right? If you When you had the idea but you didn't have people in leadership already in leadership positions that have the power to mobilize resources didn't back you up, your vision might never be true. It never become true, right? So so many things coming together has made your amazing vision into this impressive project with an amazing outcome that not just helps people and healthcare systems in Africa, but also could be adopted in the Western healthcare system. So that is extremely impressive. Um, so your work spans, clinical practice, health policy, and strategic planning. But how do these different areas kind of intersect in your approach in creating sustainable healthcare impact in the context of specifically, maternal and child health?
Yeah, when just to be a clinician or to have several exposure and experience will make your life easy when you come to policy and strategy.
Mm-hmm.
Design those activities or those strategic plan activities, you know, from the analysis, when we say there are several analyses, which is an input
Mm-hmm.
for policy and strategic plan development. And those analyses are SWOT strategy, stakeholder analysis. Uh, if you have no experience, if you have no clinical exposure, if you don't know what the problem is on the ground, it's
Mm-hmm.
difficult for you to design those strategic plans. And those strategic plans became feasible when the problem or the solution or those activities are well aligned with
Mm-hmm.
the realities on the grounds, you see. So
Mm-hmm.
previously, as I told you, while I was leading my professional association, I've got the opportunity to design strategies for SALT, for safe surgeries, for maternal and the child health. I was one of the technical working group member as the
Mm-hmm.
Ministry of Health and for maternal and perinatal day surveillance at the EPHI. So those
Yeah.
exposures give me, how to design strategic plans. When I
Mm-hmm.
went UK, one of two of my modules are policy and strategic plan development.
Mm-hmm.
And the UK education is they give you theories and models to just to apply to your own country
Mm-hmm.
problems to create solutions. So it makes my life easy,
Mm-hmm.
you have no
Yeah.
idea. When I said that, yeah, just those exposures on my background helped
Mm-hmm.
me to be, outstanding there too. And the education was easy for me, and I was one of the top scorer, and I finished with a. And what I mean is just to be, it's not only be to be a clinician, to have exposure in several platforms, to join several technical working group members, to have such, exposure will help you in near future.
Yeah.
That's my advice. Yeah.
That's an excellent point because we see a lot of people shying away from certain tables and certain rooms because they don't feel like, oh, I don't belong there. It's somebody with a, I don't know, PhD or 25 or 30 or whatever number of publications in that room, or who has been an ex-minister and or an ex-university president, and what am I doing there, right? So people always tend to focus on what they don't have and discourage themselves without nobody else even saying anything. We are our own worst enemy, as it's said in layman terms, and we stop ourselves from doing great things. But like you said, being confident in yourself, being curious and eager, and instead of shying away from those rooms, wanting to go into those rooms and be curious enough to learn and see what's going on. And then you will, like you said, it's like a puzzle, right? You might be that puzzle piece that have been missing just because of the experience you've already had as a clinician, just like you know what's happening on the ground. You have the insight that other people might not have, and you realize that you're that puzzle piece that has been missing, and you fit perfectly into the picture. So that's very important. And like you said, we exercise our strategy muscles every single day as clinicians, right? Whether it doesn't matter what kind of clinicians we are, as long as we're interacting with patients, we are day to day strategizing. So we're exercising that muscle, and then, like you said, it translates into a whole different setup and makes us so effective. So I'm not surprised that you have embraced the chevening program because I know the kind of person you are, and you are anybody who's met you will never walk away without being impressed with your work. Um, so here on the Everyday Leader we emphasize impact, and when I invite guests, it's usually guests who have done impactful work, right? You might publish hundreds of papers, but on ground, if you haven't done anything that is tangible, for me leadership is really about the labor. You have to sweat and do the labor and have something that has impacted uh, patients, students, and your colleagues and the healthcare system overall. So, how do you ensure that the high level policy and strategic plans that you're involved in, whether it's with the ministry, whether it's in the projects you've done in the UK, how does those plans translate into tangible improvements for communities on the ground? And can you give us an example? You just kind of touched on the primary healthcare project you have, but any other projects that could be a good example for this?
Um, as you have mentioned, just I have a lot of concept papers, which was just at the beginning stage, which, if I've got the opportunity, will deliver soon.
Mm-hmm.
As you have said, you could design, you will get impressed. Just you could have, just for me, what makes me impressed, just while my during my stay in the United Kingdom, was their NHS system. You see, the NHS system, they have created the national flagship.
Mm,
When several times here in Ethiopia,
mm,
the United Kingdom, but they
mm,
criticized the NHS system because they want to see for improvement. Okay. Um, so I was so impressed because they have independent King's Fund to make
mm,
that uh, NHS more productive, more
mm,
efficient, because all of the UK citizens have got the free service from
mm,
the NHS system. Even hip transplant, heart transplant, everything is for free.
yeah.
So just my vision was in near future to just make these things happen in Ethiopia. But
Mm,
as you have said, to make strategies and policies impactful on the ground, it should be feasible. Okay, it should be feasible. It should be reliable, and just
mhm,
you have to involve all the stakeholders on the ground
mhm,
to be impactful. As you have mentioned before, the specific example of my project at the health center level is, I have seen mothers previously referred from health center to hospitals for the surgical intervention. And I have seen the feedback, and
mm,
from the community, and they give us they don't even expect such service from the health center level. Is the first one, which is impactful. The other
yeah,
one is we have just expanded these surgical services to other to reach areas as
yeah,
the Oromia regions and as the Sidama also. While I visited, it's not only for the health center. Okay, we share tasks from
mhm,
hospitals. The impact is also
yeah,
on the hospital because the hospitals would get the opportunity to do elective
yeah,
cases because our table is free because we are sharing tasks at the health center. So at the hospitals, also our residency programs, they are not busy to not graduated for doing primary CS and to become gynecologists.
yeah,
They have got the opportunity to do the major electives. Okay, so this impact also contributed for the education system.
mhm,
You see, as abroad, when we see just the minor
mm,
or the minor CS intervention at the health center have several
mm,
impacts, not only for the community, for the healthcare
yeah,
system. Okay, just it will also create the the thought of possibility, the innovative
Yeah.
ideas. And I don't expect only CS will be done in near future at the health center level. Why not ophthalmologic
Yeah.
service? Just why not just some trauma cases? Yeah, just there are several. This will give the for the system to create more opportunities to look, and we call it just also innovation. And that's the impact I have seen. And as I told you before, also countries got impressed, and they are asking to just train those ISO professionals,
Hmm.
and I've been communicating with our institution. In near future, you also you come to Ghana and Nigeria, because maternal mortality there is also high, spiking high. In
Hmm.
Sierra Leone, maternal mortality is 1,000 per 100,000 live births. So in near future, you can go to Sierra Leone, Ghana, and Nigeria, and you will train those emergency surgical officers. I hope you can do it
Yeah.
also in near future.
Yeah, I hope so too, because one of I don't want to divert the topic, but one of the most neglected and uncommunicable um, healthcare burdens is trauma. And obviously maternal and child health take the front and lead when it comes to global surgery and things like that, which is understandable because it impacts two lives and society overall directly. But trauma is and its impact is close second. So I think adopting other surgical interventions at this level to increase access for the majority of the population is extremely important, and it's a very adaptable concept. Like you said, that's what innovation is, right? It has to be adaptable. It has to be flexible. It can't. It has to be repeated, something that you can repeat in different setups. So, uh, what your project is the best example for that. And I hope it does happen. And I hope we, expand and give back to other African countries as well, where such an intervention is needed the most. Um, so, given your extensive experience in, human resource capacity building across Africa, which is what you just touched on, what are some of the most critical leadership qualities that may be needed to empower healthcare professionals in a resource constrained environment?
Yeah, this one is, this is a timely issue and a timely question. Currently, healthcare workers, there is a bit difference between healthcare providers and healthcare workers, even from the definition. And these healthcare workers are currently suffering from burnout. And my dissertation was about burnout of Ethiopian healthcare workers and its impact on healthcare quality. And
Hmm.
I'm just on the way of publishing this finding also. And the burden was high, because also the definition of we are not human resources,
Hmm.
because we are just humans are the most valuable asset. Okay. This is people manage it needs people management. Just in Africa or in resource limited setting, our leadership needs to be more compassionate leadership. We have to listen our workers. We have to go deep down, and just we have to understand their problems. And to be a leader, just you have to understand your follower. Okay, so my recommendation is those leaders should be compassionate enough. What I mean by compassionate leadership means is, the community demand and deserve quality service from healthcare workers. Okay, when they come to hospital, they deserve quality service. But when we come to healthcare workers also demand and deserve quality service from their leaders.
Yeah.
Do you understand me? In Ethiopia, we are focusing only just the community deserves the quality service from
Mm-hmm.
healthcare worker, and no, but the healthcare worker as humans, they didn't get quality service
Yeah.
from our leaders. Okay, this as simple
Mm-hmm.
as that. For example, at or our public
Mm-hmm.
organization, human resource will publish your name on the board, which says, "Come to the office and just fulfill these criteria to, or bring your documentation from the institute." Look, you are as a physician. There are around 50 patients who are
Yeah.
waiting you on the board, or the surgical service. From the tourist areas,
Yeah.
they come once and got the opportunity to the hospital just in the operation theater. Why don't
Yeah.
HR just why don't they, on behalf of healthcare worker, just provide this, just as we are entertaining our patients, they have to entertain you.
Mm-hmm.
That's what leadership mean.
Mm-hmm.
Okay, that as but in our system, just that's not only in Ethiopia, actually in Africa, they understand that. They focus, or they give you non-financial incentives, which is also an input for those healthcare workers. So my recommendation is just, it's better to be authentic and compassionate leader to impress those healthcare workers. If not, they will leave the system, and finally will also be affected.
Yeah, wow. Great points. I don't think I've ever heard this put well put together like this, like how you just said it. And it's very important that we make sure the people who are burdened with all the responsibilities are actually taken care of. That's a crucial step in assuring longevity, right? Career longevity. Whoever, whatever profession is, whatever level of experience, whatever level of training that person has, longevity is extremely important. Um, and that's one way of sustainability. So um, you might train so many fresh graduates, but are those graduates are going to stay in the workforce? That is extremely important to consider. And I think so far, mid-level. Oh, I think we lost Fitsum. Um, can you hear me? Fitsum, can you hear me? Okay. Yeah, so mid-level management people, like us as head of departments or representatives of different societies, we have tried to bridge that gap that you're just talking about by um, trying to make it easier for our staff, to try to keep the well-being of our staff and create an environment that can lead to job satisfaction. But as a leader as well, you do get burnt out over time because these things require systemic change. So I'm with you on such a movement, and it is a timely movement that everybody needs to get on board with. So let me take you to your traveling journey. And as a traveling scholar, you've gained an international perspective on leadership in both healthcare and social care. So how has that global exposure influenced your approach to leadership and your already existing work in the local context? How did that it influence you?
Thank you. Chevening is UK fully funded scholarship, which will allow me to meet different people who has a different background. So just even my education, it was international students, and I've got the opportunity to be a student leader, and also I've
Oh, apologies for that. This network can be very unstable. So we'll be back after a short break. Okay, and we are back. Okay, go ahead.
yeah. Yes, this evening scholarship gives me the opportunity to meet several people from different backgrounds. So what I did was when I immediately returned, I've just knocked several just offices, including the Ministry of Health. Just you, if you sit and wait for the post to be just to welcome you, it doesn't work because evening taught me that you have to go to people
Mhm,
to meet them, to communicate with them, and share your ideas. You have to sell yourself. Okay, that's what makes you outstanding scholar. So
mhm,
just since my return, I've been involved in several strategic plan developments, just in several training module developments, and
mhm,
currently I'm an intern at Ministry of Health at the Health Service Quality and Innovation team, and
mhm,
immediately when I return, I've been just be part of global conference in Addis Ababa for the first time
mhm,
with GACOPA. And last week we just uh, also entertained the first global quality conference,
mhm.
which was just impressive. So today I'm here at the Bishop to write the outcome of the summit. You see, I'm
Mhm.
not sitting and wait to somebody to hire me.
Yeah,
That's the outcome of your networking skill. If you sit and wait for the post to call you, just or if you sit and say I'm just back from UK and my title is international leader, no, nobody will call you
yeah,
back.
yeah,
Just you have to understand the system and you have to be part of the solution. Okay,
yeah,
you have to knock or every opportunity,
yeah,
go and ask them, communicate with them. It seems difficult, but just it depends upon your concept ideas. And
yeah,
tomorrow, who knows? You will achieve your dreams too. And when you get that opportunity, you can interpret or you can apply what you gain from your that education.
yeah,
So
yeah.
humbleness, communication, and your just authenticity matters above all.
Hmm. Wow. Yeah. There's so much to learn from what you just said, and recently, we had physicians boycotting for legitimate reasons, right? For questions that have existed throughout times. Um, and you see the discouragement. You've seen we've seen how discouraged people have been over the years, tirelessly and limitlessly giving, pouring yourself and your passion into something and never being compensated. And you feel like the walls are closing in and there's no escape. But what you just mentioned is very important. You have to knock on different doors and be strategic while you're doing it. Network whenever you can and use your network to influence change in your system, right? So if you knock on the door and it doesn't open, well, you might have to kick it in. And we have done that. People like you and me, we have kicked down doors and did what we had to do. Yes, you might get bruised, you might have disappointed certain people or certain groups, but at the end of the day, once people see the impact and share your vision, then people come on board, and then it turns into something beautiful. So I think that's an important lesson that you just put out there for young generation of healthcare workers, to prepare themselves as to what might wait for them when they join the workforce, and how to best deal with it. Um, but by the way, we've been talking for an hour, and it's been great because it doesn't feel like an hour.
Yeah, sure.
uh, yeah, and looking ahead, what's on your big, hairy, audacious wall you have for healthcare in Ethiopia or across Africa? And how do you see yourself contributing to it as an impressive and well recognized everyday leader?
Um, you see, I've tried to reach out previously. As I told you, when I was in Ethiopia, I thought UK national health system was weak, because what we hear from the news always is crisis and strikes. And when I just arrived there, the quality of the healthcare service was outstanding. The community, just one of my professor, she has heart surgery. She has also hip transplant, and she has appointment for another surgery. Imagine, when I
Wow.
asked them, just they told me that they have got this service for free. Imagine. And I asked them why they criticize NHS. If it was free, why do you criticize? And they told me that we criticize it because we want its improvement. Imagine. And they have independent King's Fund, just expertise,
Hmm.
in the healthcare system, scientists. They have just this independent King's Fund to criticize and to point the point of improvement, and they just it was so impressive, so amazing. The community, even their healthcare policy have impact on immigration. Huh? Their healthcare policy
Wow.
have impact on the higher level, at the policy level. So
Wow.
my future goal, if my wish list is to see the strong healthcare system in Ethiopia, who will stand for the community. We don't have
Mm-hmm.
to pay out of pockets. Okay, this is in to protect inadvertent cost. You see, we have to
Yeah.
strengthen our healthcare insurance. It's not about the number, okay? It's not about the coverage. You might call 70% of the healthcare system got the health insurance. No, we have to look.
Mm-hmm.
My wish is to see this just higher, expensive surgeries to be free for the community. So, to make this happen, we have to have a strong healthcare system.
Yeah.
Uh, that's why just I return back. It might be the right time now in near future. If I've got the opportunity, I will contribute
Yeah.
for this system improvement or health system strengthening. Okay, after all, we all
Yeah.
contribute to just strengthening the healthcare system. Just we have if we show the tangible evidence for the community and the policy, everybody will come to the chair and they will support us, and we could have just expertise, independent, and uh, experts to just criticize our healthcare system
Mhm.
for improvement. Just
Yeah.
in Africa, just when you criticize, they thought in different way. But in UK, even when we write essay, when you criticize their service, they'll give you a good result or a good point by grading. Yeah, but I hope we will see. There are also some improvements now. Just we need to just give. the opportunity for educated or for education too. Just I don't
Hmm.
think we have that opportunity now, but I'm optimistic. In near future, it's we, we can make it real happen, and we can give the opportunity for others too. That's my wish.
Yeah, wow. I hope it comes true because uh, all are very impactful and, with a positive impact. And it's all about sustainability. And that is one of the major issues we have in our healthcare system, and especially also in Africa. Many other countries share that challenge with us. And you can attack sustainability in different ways, but nothing beats universal health coverage, right? It has been tried, kind of. It has its own shortcomings so far, but I hope, like you said, we learn from the mistakes. We criticize and reflect on the things we have done, instead of, when you collect data, instead of trying to manipulate it to show the positive side of things, you also want it to be, like you said, authentic, so that you can see where you're lacking, and then strategize on, to fill those gaps that have been identified. So yeah, I think authenticity is extremely important in policy making, in our context, in most of African setups. And we have to understand that, as leaders in a resource constrained settings like ours, we are burdened with so many things, because our majority of our populations are uneducated, they're illiterate. So, but we know what they suffer from, so we are burdened with, having the responsibility to ask questions that they are supposed to ask, but they don't know how to ask, they don't even know if it exists. But we have been exposed to it, and we've seen both sides of, the system, whether it's the West or, the global South and everything. So there's a lot of burden there, and you have demonstrated that, with willingness and, a little bit of wheat and dedication, we can take on that burden and make a great impact. So thank you so much, Fitze. I appreciate you so much. I appreciate your time. um, a shout out to your lovely wife, Dr. Luli. I hope she's doing great, and your little princesses. um, just, I appreciate you for dedicating your busy schedule to sit down and do this with me. I hope to see you and collaborate with you in future projects as well.
Thank you so much, Sunny, for giving me this opportunity because yeah, just this is a great platform. We have to think about just to make it more beyond this streaming, and I hope we could join again in the big studio, and I hope this is. There is no platform in the healthcare, especially in the everyday leader. We can make this project real, and I will confirm for you that I'm really interested, and we can collaborate, and I will join you, and so we can also invite several leaders. Okay, so from our healthcare system, regionally and globally, to be on the chair and to host such a big um, event in the future. So I want to say congratulations because you have already
Thank you.
started it. So keep this momentum, and
Thank you.
I will join you anytime. If you anytime anywhere, uh, we will rejoin again. And I want to say keep it up. Thank you so much. God
Thank you,
bless.
Fitze. Enjoy the rest of your Saturday.
Bye. Thank you.
Bye. Okay, thank you for our audience. Thank you for joining us for this incredible episode with Fitsum Taye Negash, from Vision to Impact, an internationally recognized strategic leader. healthcare leader. You can find the recordings both on my LinkedIn at Ananya Kasaon Admasu, Ananya K Admasu, and our YouTube, the Everyday Leader podcast. Subscribe, like, and share the videos to those of the people that you think might benefit from listening to this amazing conversations. Enjoy the rest of that your Saturday, and see you next time on another the Everyday Leader episode.